dentition, you don't need to because the sutures is not as interdigitated for that reason. Okay, now, if you have a cell phone, take this picture, very important, because if you want to do early treatment, you have to follow this protocol, all right? First of all, there are 3 questions that you must ask. 1, what is the overjet? What is the molar relationship? Okay, you're going to check that one out first. And then the next most important question is there a functional shift when the patient close together? That means you need to check the bite eccentric relation. Alright? Otherwise, you're going to do the wrong measurement. Then the final question is, there are 2 types of class 3 growth. One of them is upward and forward of the mandible. The other one is downward and backward growth for the mandible. You can see there are 2 different types of malocclusion with different occlusal plane inclination and also lower base height. All right? So once you ask these 3 questions, then you're going to come up with 4 different types of class 3 malocclusion, all right? And the one that are most easy to treat with the face mask will be the low angle functional type, okay? Remember that, all right? The one that will be most easy for you to treat is the low angle, that means maybe decrease lower face height, all right? And it's also functional. That means the patient has a centric occlusion, centric relation discrepancy. Okay? So that is for this slide, all right? Then the next one, you need to take a picture. Okay, move up your cell phone, take a picture, all right? Is the timing of treating early class 3, all right? So you will find out that it is going to be in the mixed dentition. Alright, so patient have an anterior crossbite, overclosure of the mandible, wonderful for the face mask treatment. Alright, but the tricky part is once you corrected the anterior crossbite, you must learn how to wait until, if it is girls, 14 years old, if it is a boy, 17 years old, before you put back the braces to finish your treatment. If you do it early, because there's a lot of pressure in the school, because all of their friends already have braces at age 12. And then I have to wait until 14 for a girl, or 17 for a boy. Alright? So that is testing your patience. I will show you a case to illustrate the importance of wait until this age to make your final decision. Alright? And the last thing, before we start looking at cases, that you need to understand is, for people who have a deficient maxilla, you must also consider the premaxillar area, that means the anterior part of the maxilla, including the reason why you need to use expansion appliance in class 3 cases, okay? Because this is from Dr. Dallaire way back in 1997. He said that other than putting the teeth and the jaw in the correct positions, you must consider muscular posture, tongue posturing, all right, swallowing, and then sleep apnea, right? You must consider all this functional Otherwise, you will find relapse after treatment. Okay? So that is all I want to say about the philosophy of early class 3 treatment. So we're going to start, okay, treating patients. And the first question I want to answer you is, why do we want to treat this patient in mixed dentition? If you remember your growth and development, between birth and 5 years old, the maxilla are being pushed down and forward by cranial base. All right, development of the cranial base. All right, and then starting at age 7, which is mixed dentition, there is sutural remodeling. It starts at age 7. Now, when do they end? Somewhere around 11 years old. Between 7 and 11, you have active maxillary sutural remodeling. All right? And you also understand that by 13 years old, you will have to use some sort of a micro implant to help out, because the sutures are getting much harder to separate. All right? So the golden time for maxillary protraction will be 7-11. Do you have one in Vietnam? 7-11? Do you have one? So next time you saw 7-11, yes, that's the time to expand and protract. All right, remember that, okay? So that answers your first question. So let's take a look at the patient. So this is Victoria. She's 8 years old, so it belongs to 7-11. Everybody say it together, 7-11. All right? So 8 years old, mixed dentition. So she has a little protruded lower jaw. So the first thing you need to check is COCR discrepancy, right? I mean, she has an anterior crossbite, but the question is that a real skeletal class 3? So what you need to do is to check for the difference. If the patient can actually bite end to end, it's some of you call pseudo class 3, right? Okay, it's easier to correct, okay, and easier to jump anterior crossbite. Now, the question is, when you take a lateral set and the patient has significant COCR discrepancy, do not take it in centric occlusion, because it's a false reading. Because the mandible protruded forward and upward, all right? Okay, so you need to take it end to end, and then use an XCT paper to rotate your mandible upward. Then you can do the measurement, all right? So here is the diagnosis, and then you need to figure out the treatment strategy, all right? Now, Dr. Wims is very good because he has all different design of his appliance, all right? His strategy. So now we don't have mini screw to help out. So what would be your strategy? By the way, I don't know what is the Vietnamese translation. That word strategy is very, very important, because it's how efficient can you move the maxilla or the upper jaw forward. How efficient, all right? When you go to the airport, there are different ways, all right? You can take a helicopter, go to the airport, but it's not very efficient, okay, for that reason. But there are at least 3 ways if you want to move the upper jaw forward faster, okay? Number 1, you protract the maxilla along the center of resistance of the maxilla, along the center of resistance, because in that case, you don't tip the maxilla, you translate the maxilla forward. Okay, I will show it to you. Second, you may want to use Dr. Eric Liu. Expansion, constriction, expansion, constriction, expansion, constriction, to basically distract the maxillary suture, distract. That means loosen up the maxillary suture. Then it will move faster, right? And the third thing is, you might want to use a combination of face mask at night and then class 3 elastics during the daytime. Okay, I repeat. Face mask, which is orthopedic, 16 ounces on each side, all right, or 600 grams, all right? But during the daytime, you need to supplement with class 3 elastic, which is only 3 to 5 ounces, but it's necessary. I will show you why, all right? And then finally, overcorrection, all right? Because you are anticipating future disharmony of growth between the upper and lower jaw, all right? So those are the 4 strategies. So now I'm going to illustrate that with Victoria, all right? First of all, why do you want to translate the maxilla forward, all right? And the center resistance of the maxilla is actually between the Frankfurt horizontal, which is underneath the eyeball, and the occlusal plane of the upper first molar. All right, in between, all right? So if you protract the maxilla below the center of resistance, then you're going to tip the maxilla, all right? So don't do that, all right? And I will show you how, one way you can protract the maxilla along the center of resistance, okay? And there's publication that you should protract it in the canine area about 30 or 40 degrees below the occlusal plane or the Frankfurt horizontal. 30 or 40 degrees in the canine area, not in the molar area, right? So then it will be protracted along the center of resistance of the maxilla, all right? So then here's the face mask, here's the rubber band, which is forward and downward, and take a look at the 2 wire sorter to the first molar. They were extended to the canine area, okay? So 30 degrees down and extend it to the canine area. Now you can protract the maxilla along the center resistance of the maxilla, all right? So this is Dr. Eric Liu, the expansion, constriction protocol. So it's 7 weeks. Now, if I don't do it, is that okay? Yeah, of course it's okay. But it would take you 1 year to protract or jump the anterior crossbite. All right, but it only takes me 4 months, okay, to jump the anterior crossbite if you use. So what age should I start using expansion constriction? Any patients over 8 years old. Any patient over 8 years old. Now 5-year-old, you don't need to do it because wow, the sutures are wide open, right? 8 years old, 9 years old, 10 years old, 11 years old, expansion, constriction, expansion, constriction. Now, I'm going to try to show you a movie, all right? So if you do it for 7 weeks and you grab the maxilla, it's actually loose. All right, if you like to play around with that, all right, check it out. In a mixed dentition, if you've gone through 7 weeks of expansion, constriction, that is how loose the maxilla is. And now you started protracting, it's gonna move faster, all right? Now, then the third strategy is, at night, you put the face mask, which is on that hook in the canine area, right? But during the day, you must supplement with class 3 elastics, which is only about 3 ounces, all right? So what happened is, at night, the maxilla came forward. During the daytime, the elastic hold it. So forward, hold it. Forward, hold it. Forward, hold it. All right? So that is how you'll be successful. So in 3 months, we jump the anterior crossbite. All right? Then some people ask, hey, why can't I just tip the upper incisors forward and jump the anterior crossbite? I don't want to do that. Why? Because the inclination of the upper incisors is already in normal position. So you want to move the whole maxilla forward instead of tipping the upper incisors forward. All right? So if you can, go ahead and overcorrect the overjet to excess overjet about at least 3 millimeters. All right? So right now the patient is 9 years old. All right? So you can see the profile actually improved at 9 years old, just because it's only less than 1 year treatment, right? Then the next thing, which is testing your patient, is you're not supposed to touch the patient until what age? What age? In the girl. What age did I say that before you can put braces back on again? No, 17 is for boys. What about the 14? All right, so 9 years old, you check the crossbite. Okay, if profile improved, the maxilla is in very good position. Here is 12 years old. By the way, sometimes I'm a little scared of seeing this patient because if the mandible grows too fast, the patient was going to come back with an anterior crossbite. So what would be the best way to check if the jaw are growing in harmony? Is the overbite, all right? If the lower jaw growing faster than the upper jaw, your overbite is going to decrease, all right? So this girl right now is 12 years old. No more braces, right? So are you going to stop here or are you going to continue seeing this patient? Are you going to stop here or are you going to continue seeing this patient? Continue to see until what age again? It's a girl, 14 years old, okay? So here is the girl at 12 years old, looking pretty good. Here is 14 years old, all right? So, is the patient still class 3? Yeah, it is still class 3. Look, the lower incisors tip back, right? So the question is, are you going to do jaw surgery on her? I don't think so, okay? So that is when, at age 14 for a girl, you have to make the decision. Surgery or no surgery, all right? You take a look at her, 14 years old for a girl, because there's not going to be any significant change from that point onwards. So you can tell the parents, surgery or no surgery, okay? So that is the benefit of early treatment, right? So you take advantage in the mixed dentition 7-11 where the sutures are still loose, all right? Okay, now, second question. What if I don't use expansion applier, all right? I cannot use the hybrid Hyrax in the mixed dentition, okay? If there's no expansion appliance for that reason, right? So what should I use, okay? Then I ask ChatGPT. How many of you use ChatGPT? Raise your hand. Yeah, you use it for what? Taking exam? I mean, this is just kidding, all right? So here is Cambry, all right? 8 years old, 7-11, all right? So now, by the way, the green line is Dr. Larry Andrews' aesthetic line, all right? If the upper incisors did not touch that green line, look at this. The upper incisors is way behind that line. So what does that mean? She's ugly. You're supposed to laugh, okay? She's ugly. Right, you're supposed to laugh, okay? Yeah, it was a joke, okay? So she has maxillary deficiency, all right? Okay, now if you take a look at the bite, here's the anterior crossbite, all right? So what's the second thing that you should check? What's the second thing? Oh, you are wearing this, okay? I'm going to ask somebody who did not wear one of this, okay? What is the second thing? That's right. You check for COCR discrepancy, right? Okay, so that's, and also if you do an intraoral scan, all right, then you can check if the width in the anterior and the posterior match or not. That means intermolar and intercanine. You gotta check both. Because sometimes intercanine width is narrow, sometimes intermolar width is narrow, okay? So this particular patient, intermolar is okay, but intercanine is a little bit deficient. That's why, okay? There is crowding on the upper arch, okay? So, Panorax OPG said no problem, all right? So here's the diagnosis. By the way, is this a dental class 3 or is it a skeletal class 3? Let's see who is not wearing one. Ha ha, you are not wearing it. Ha ha. Is it a dental class 3 or is it skeletal class 3? Dental. Everyone agree? It's a dental class 3, right? So how are you going to treat this? Patient said, I don't want expansion of eyes. So how are you going to treat this patient? Any suggestion? Huh? Are you going to use brackets or no brackets? No brackets. So you're going to use clear aligners? No. So she just want to have a biplane and tip the upper incisors forward, right? You can do that. Anybody who want to use aligners to treat this case, raise your hand. Oh, have you ever done that? You have done that. Is it successful? Oh, now you guys better go to this guy over here, all right? So he has used it. I'm going to show it to you how I did it, all right? So, yeah, I have a biplane, all right? But that's not to jump the anterior crossbite because I'm going to be using clear aligners, all right? So here is the clean check, okay? I want you guys to see the increase in width, all right? So let me see if I can go back, okay? And maybe I cannot go back. Okay, now here we go again, all right? Now take a look at you see the increase in the width, all right? So altogether, it's 16 aligners, okay? So you jump the anterior crossbite, all right? And you also basically correct the width, okay? So, here is clinically aligner number 3, and I added on a face mask, which is kind of cool, okay? Because this particular company has a button, they call it angel button or angel hook. You can put it in there for nighttime connecting to the face mask, and then daytime class 3 elastics. Isn't it cool? You know, just add a few buttons in there. You can try it, all right? So, does it work? Check it out. Okay, so nighttime and then daytime elastic. So, 7 weeks, okay? Now, each aligner, just 1 week, all right? You don't need to go 10 days or 2 weeks. Just 1 week, all right? So, 10 aligners, all right? That's how she looks like. All right, 10 weeks. You already jumped the anterior crossbite, you know, in 10 weeks. All right, so you check the occlusion. All right, okay, now let's go back a little bit first, okay? So the question is, how many millimeters did I get for expansion? Interesting, all right? So hold that a thought, okay? So my question to you, especially, by the way, who are the students here? Raise your hand. Who are the orthodontic students? All right, there are 2. There are only 2. Is anybody over here a resident, orthodontic resident? All right. Okay. the resident. How many millimeters, if you want to do some research, how many millimeters do you think we can get expansion out of clear aligners? How many? Well, I mean, you are too smart, you know, you already asked a different question. And obviously, I only have the model, so it's a combination of skeletal and dental expansion, right? So how many millimeters? Give me a number. 6? Wow, see, these students are smart. 6 millimeters, that's not too bad, right? Now, before I tell you the result, okay, I want to give you another patient because I mean, there's no way that you treat one patient and you said that, oh yeah, it works, right? So, and then the last one is, you said is dental class 3, right? Take a look at this, okay, patient. Now, Patricia, all right, she has also anterior crossbite, posterior crossbite, but she also has another problem. So, what's the problem? Missing teeth. How many teeth are missing? 2 lateral incisors. Is there anything missing? Why is the lower first molar fully erupted and the upper molar is 2 upper molar and 2 upper lateral incisors? All right. Okay. So I mean, I have to show you some numbers because just to convince you that this is not a dental class 3, okay? This is sort of like a skeletal class 3 for that because of the width, because of the A and B, all right? So now, here is the problems. So the strategy, yeah, so I'm going to use the same thing. All right, clear aligners, because the patient doesn't want expansion applied. It's just the hygiene is not so good. All right, so, and we're going to do the same thing now. Watch how much expansion, okay? You're a student back there, okay? Watch and tell me if you hold the whole one to 6 millimeters. Now, so you are going to do arch development, okay? To make space for the lateral incisors, all right? So, I mean, you are pulling the clear aligners with 16 ounces of force on each side, okay? So the question is, how are you going to make sure that there is enough retention of that appliance? So obviously, there are 2 things you can do. One is to increase the trim line. All right, you understand what the trim line means? How much it covers all the way to the gingiva. All right, so don't stop at the gingival margin. Okay, go further up. Okay, so you get some, because we are going to do protraction and also class 3 elastics during the daytime. So this is Patricia. Okay, so it takes 23 aligners. Okay, so we jump the anterior crossbite. We open up the space for lateral incisors, and the posterior teeth obviously need a little bit of settling for that reason. All right. Now I only have 60 minutes left because I'm supposed to talk about tabs or mini screw like Dr. Williams. Right? I have to because otherwise, I mean, this conference is about mini screws, right? So for patients who are in permanent dentition. So let's say you miss the golden period, which is 7-11, right? You miss that, right? And you have the sutures that you need to go against, which is the zygomatic buttress, the cheekbone, okay? All right? The pterygoid plates back there, and also the nose area, which we call piriform, okay? So those are the areas that I'm going to start talking about the MOD-P appliance, so Dr. Williams will continue this afternoon for that, all right? So, by the way, 2025, there is a consensus. Go out to 26 experts in orthopedics, and they all agree, if you want more efficient orthopedic treatment, it would be best to do it with pads. Right, Dr. Wills? You agree? Yes. Okay, so that is if you want the sign, okay? So you can do that, all right? Now, I'm going to move on. So I'm going to show you one last patient. Now, 13-year-old boy, right? It already passed the golden time, 7-11. Early permanent dentition. All right? So, again, he doesn't look very good because his upper incisors is behind the green line, right? So you need to move it forward for that reason, at least for the aesthetic part of it, right? But this is how his bite is like. Now, if you take a look at the upper arch, there is no space for the canine, correct? Look, you got the first bicuspid right next to the lateral incisor, all right? So you have severe crowding in the upper arch, and you got the anterior crossbite. So let me ask the student in the back there, okay, sorry, I will keep bothering you. Extract or not to extract? So she shake her head. When are you going to make that decision? Extract or not to extract? Until when? No, 13 years old. It's a boy. It's a boy. 18 years old, you will make that decision. Are you kidding me? So you're going to have him wait 5 years? Because you have growth to consider, right? This nostril, that's number one. Number two is your width is not done yet, all right? The width, you don't know how much space, because every millimeter you expand, you can get 0.7 millimeter of space, right? But you have to expand a lot because he's got 8 millimeters deficient just on one side, all right? So it's a tricky situation, all right? And of course, so if you cannot use convention expansion appliance because he's already past 7-11 for that reason, all right? So what are you going to do, okay? There's no teeth missing, all right? But take a look at the third molars at the back. I mean, this is fighting the second and third molar. They're fighting to come in. It's kind of like you're the mother, you're pregnant, there's a pair of twins. Who's going to come out first? By the way, that's a joke, okay? You're supposed to laugh, okay? There's a pregnant mother, a pair of twins. Who's going to come out first? Depending on whether the baby is Asian or not, right? Or Vietnamese or not, for that, because you guys are a little bit more courteous. Okay, for that reason, okay? All right, so you did your septometric analysis. He does have some skeletal problem, okay? And now, the reason I want to show you this case is not his perfect case, all right? There is a problem there, okay? Take a look at the design of this appliance. First of all, I use the Rollo band, which is good. It reinforces the molar bending, okay, so it won't break. But I'm supposed to extend it to the canine area, right? But I extend it on the palatal side because the upper canines are erupting on the outside. But biomechanically, that will be below the center of resistance. So you're gonna have some bite opening. So this is a MAPI appliance, okay? And you're going to be putting 4 screws in there for bony anchorage support, all right? So we're going to go ahead and expand, okay? And you can see some tissue reaction to the MSC appliance for that reason, all right? So, but don't worry, okay, because there are people who are allergic to nickel for that reason. So we're gonna go ahead and expand, all right? And you're gonna see the students over there, if there's enough room for accommodating the two canines and so the premolar at the back there, okay? So it turns out, okay, that we were successful, all right, as far as getting enough space for, but you can see the difference in the arch form, the upper arch and the lower arch, all right? So in this case, we are lucky that we don't need to take out any teeth, okay, and the teeth basically looks parallel, and also his upper incisors right now is closer to the green line, so it actually looks better for that reason, all right? Now, I only have about 21 seconds left, okay? Is it 10 minutes or is it, do I have 10 minutes? Okay, all right. So, one last question. What if your patient does not want to wear the face mask? See, you understand English, okay? What if the patient does not want to wear the face mask? And this little boy also had maxillary deficiency, right? Both the width and the anteroposterior. What would you do? Are you going to use clear aligners? Well, he's 12 years old. He's past what? 7, 11. So that's not good, okay? Clear aligner is not good. So what are you going to do? You're going to refer to your friend. The functional appliance, what you're talking about, FR3 or what kind of functional appliance? The what? Activator, followed by what? Fixed appliance. Okay. Okay. Are there any other suggestions? Well, by the way, you need to protract the maxilla forward, and the patient doesn't want a face mask. So what do you do? All right. I mean, look at the upper arch; it's so narrow in the intercanine area. All right. The lower arch is very oval, right? And then there is one more problem. All right. Not about how the teeth fit, but you know, it would be nice if you have a few more teeth. Alright? If you want to protract the maxilla, you gotta have teeth for that reason, right? So if you don't have enough teeth and you don't want to wear the face mask, it's a problem. Okay? So what are we gonna do? Well, you're gonna take X-ray. Whoa! The width is minus 13. Is it minus 13 the width? By the way, the normal width is 0 or minus 1, right? So is it good, bad, or is it ugly? Huh? Good, bad, or is it ugly? See, I think I lost it. Okay. Bad means that you can camouflage by orthodontic movement. Ugly means that you're gonna need surgery. Is it good, bad, or is it ugly? So you think it's ugly. You think it's ugly. Anybody think that it is good? Raise your hand. Yeah, hopefully it's not the student right there. Okay? Now, by the way, the student, is it good, bad, or is it ugly? It's kind of ugly, right? Okay, so here's the diagnosis, okay? Oligodontia, all right? And castrate skeletal problem, maxillary deficiency, congenital missing teeth. So here is some option. By the way, this is not strategy. This is an option, all right? Surgery first, right? Because it's class 3. The second thing is maxillary expansion will not be with face mask, but patient decline. face mask, so that's no good. All right? And the bullet plates. Okay, with class 3 elastics, we call it the BAM. All right? By the way, you guys heard of Hugo the Clerk? Anybody heard of Hugo the Clerk? Raise your hand. Well, he's the one who talked about the bullet plates. All right? But the problem is, the plates has to be in the lower area, and it's very, very traumatic. Okay, they put a plate on the upper, put a plate on the lower. Right? Then final thing is micro-implant assisted maxillary protraction. So you can maybe do class 3 elastics full time instead of a face mask, but you gotta have a bony plate on the upper, you gotta have a bony plate on the lower. All right? So what are the options that you can do? Well, you can do something like that. All right? So basically, this patient have edentulous area, so you can actually put a few mini screws on the lower, and you also can put some sort of a MAPI appliance on the upper, but the patient only wears class 3 elastics and 24 hours. All right? It would not work, okay, if the patient only want to wear it about 12 hours, 14 hours, because you don't have the face mask. All right? But you'll be amazed. You actually don't need 16 ounces of force, because those are called heavy intermittent force. All right? So patient wear the face mask at night for about 12 hours, 10 hours, and 16 ounces on each side. But you can offer the patient alternative. All right? You wear it for 24 hours, and you don't need to wear the face mask. All right? So that's what we offer for this patient. So those are the plates that you put down in the edentulous area. All right? So you're going to protract. So we reduce it from minus 13 to about minus 6.5, and then you basically put prosthetic teeth until the patient's finished growth, because the patient is only like about 14, 15 years old, and then you can put on prosthesis to replace it. All right, so you can see. I mean, the reason I want to show you this is there are orthopedic effect with just elastics. Very interesting, all right? So that would be probably one option you can do. But you can also see this particular boy, look at that. He's got growth during the treatment. So if you don't have anything orthopedic in there, or have orthopedic in nature, you're not gonna make it, all right? So, the final slide I want to show you is there is always the dark side about using mini screws, right? It's not like it's totally problem-free, all right? And you definitely have some inflammation, you got tooth discoloration, you can have appliance break, asymmetric expansion, all right? How do orthodontists took care of asymmetric expansion? You camouflage it with orthodontic tooth movement. But inside, when you do expansion, they are not always. About 60%, okay, is symmetric. About 40% asymmetric. So we still consider that to be kind of like a side effect. So if you want to read a little bit about it, be my guest, okay? So I'm going to conclude my lecture because I answered 3 questions. The golden time for doing maxillary protraction, if the patient wear the face mask, 7-11, all right? If the patient doesn't want an expansion appliance, you can choose. Now, 7-11, I'm not talking about a 13-year-old, okay? you can choose to have clear aligners with the buttons already, and also design your appliance to have maximum retention while the patient is wearing it. That means you still have to put attachment in the primary molars. Okay, remember, if mixed dentition, you put attachment on the primary molars, you have to edge longer. Okay, edge longer, otherwise they won't stick. All right, and then the final question I answer is, what if you miss, okay, to go to the age of 7-11, then obviously you're going to stick with the MARPI appliance. So in general, in my clinic, any young patients above 11 or 12 years old, I will go ahead and put MARPI, even just for expansion, all right? Because if, think about it, okay, if it is your children, would you want the upper molars to tip out? Alright? Because every time you tip it out and it's upright, you're gonna lose buccal bone. Alright? You compromise the periodontal situation. So if you're not gonna do it for yourself or your children, your own children, don't do it for other patients. Okay? And it's not so scary because Dr. Wim's gonna show you putting MARPI appliance in patient is a piece of cake. You just have to get over that hump, okay? Then you'll be a lot more successful because your expansion is going to be more stable. Okay, thank you everybody for your kind attention.